Since 9/11, there have been a lot of changes in how the United States deals with immigrants. One of the biggest is the explosive growth of a system of immigrant detention centers that few Americans know anything about. Immigrants who come into the country illegally or refugees who apply for political asylum often go into detention, some for many months. Before 9/11, about 100,000 detainees went through this system each year, but today, with stricter immigration rules, that number has tripled to more than 300,000. The surge appears to have overwhelmed the medical care provided to the immigrants. Now, a Washington Post investigation joined by 60 Minutes has found evidence that immigrants are suffering from neglect, and some don't survive detention in America. This is Haiti in 2004, when United Nations troops were fighting militant gangs in the streets. 81-year-old Reverend Joseph Dantica, a Baptist minister, saw his church ransacked, so he fled to the United States and asked for political asylum. His niece, Edwige Dantica, says he was taken straight to a U.S. immigration detention center.
He was essentially arrested.
Yes, I consider it an arrest because he had to ask for special relief for him not to be handcuffed, and they did allow him that, but told him that if he ran, they would shoot him.
Reverend Dantica raised Edwige in Haiti. She moved to the U.S. at the age of 12 and grew up to become a prize-winning author. She was waiting for him in Miami.
When you heard that he was being detained, what did you think?
Well, I was horrified. 81 years old, and after the ordeal that he had been through in Haiti, I worried about his ability to handle that.
Records show that 2 days later, during an asylum hearing, he became violently ill and collapsed. A detention center physician's assistant failed to recognize that Dantica was in serious trouble.
Help me understand, from the records that you've seen, precisely what the medics said about your uncle and his condition.
It appeared that he said, I think he's faking, or something to that effect.
It took 4 hours to get him to an outside hospital. His family wasn't allowed to see him. In a day and a half, Reverend Dantica was dead. The medical examiner said it was pancreatitis.
What did you think in that moment?
Just a series of things. Of course, a great deal of sadness, because he had died so alone.
Had died without his family.
Yeah, and after being treated like an animal.
Treated like an animal?
Someone who was just trying to escape horrible things, who was so old and sick, just had to die that way.
But in one sense, Reverend Dantica was not alone. He's among hundreds of sick or dying detainees inside 22 detention centers, plus state and local jails. The federal lockups range from this former warehouse in New Jersey that houses 325 to this desert facility near the Mexican border. They're run by U.S. Immigration and Customs Enforcement, known by its initials, ICE. Inside the detention centers, medical care is provided by another federal agency, the Division of Immigration Health Services, or DIHS.
31st.
Reporters Dana Priest and Amy Goldstein of the Washington Post have been investigating DIHS.
This is not just some deaths or just some sick people anecdotally. If you take them all together, they show poor medical judgments, faulty administrative practices, sloppy paperwork, lost medical records, and very dangerous staffing levels.
Priest, who contributes to 60 Minutes, and Goldstein have obtained thousands of internal DIHS documents. Their investigations, emails, autopsy reports, and complaints.
What sort of a picture do they paint of how DIHS is working?
They show a bureaucracy that offers many immigrants no care or slow care or poor care, and they also show that the employees inside are panicked about this.